Hi, I'm Sambo Patrick, the Health Queen, and I'm talking about tonsillitis today in children. Now, if any of you have had tonsillitis, even as an adult, you'll know it's extremely painful. You wake up, your tonsils are actually little lymphatic tissue, so they make white blood cells, and they sit kind of here and inside your throat. Now, when you open your mouth and look in the mirror, you can see them down the flanks, and they're just, when they puff up, they'll become quite noticeable, and they can exude a white pus. They can get what we call crypts, so they end up with a dimpled effect on them, which will be filled with white pus as well. Now, tonsillitis is painful. It'll start off with a red throat, and it's commonly strep. That's the most common cause, but other bacteria will cause it, and certainly viruses can cause it as well. So you might wake up, it's a little bit sore to swallow. As the day progresses, the tonsils will get more enlarged, and it can get to the stage that you can't eat or pass food past it because they are so swollen and sore. There's a couple of ways you can manage it. So you could go along to a doctor and have it diagnosed that way and get yourself on some antibiotics, or you can go natural, which would include lots of gargling for pain relief, boosting your vitamin C and zinc, and some natural bacterial agents or homeopathics to get rid of the infection. Chronic tonsillitis usually means that there's an allergy, a food allergy or a pet allergy or a plant allergy, and that needs addressing because otherwise the person's going to end up with tonsillitis ongoingly, which can affect a few things. So chronic tonsillitis, what happens overnight is the child will, or adult as well, will make a lot of mucus. Now that'll trickle down into the tummy. So typically there'll be no appetite. These children end up quite skinny and also quite dark under their eyes because they're fighting off an infection or an allergy. And they might snore in their sleep as well. Now it's really, taking tonsils out aren't as common as it used to be because they can bleed quite a lot. But in some cases it's actually warranted because it resolves the issues straight away. But get onto the allergy stuff first, clean up their diet, get the diagnostics right and see how you go. That's all for me on tonsillitis. I'm Sambo Patrick, the Health Queen, www.healthqueen.com.au.